Parkinson's disease. It was originally described by James Parkinson and is named for him. It is known to result from the degeneration of dopaminergic neurons in the substantia nigra pars compacta. The incidence and prevalence of Parkinson's disease increase with advancing age, being present in 1% of people over the age of 65 years. The disease is twice as common in men as in women in most populations. In normal individuals, basal ganglia output is inhibitory via GABAergic nerve fibers. The dopaminergic neurons that project from the substantia nigra to the putamen normally have two effects. 1. They stimulate the D1 dopaminergic receptors, which inhibit GPI via direct GABAergic receptors, and 2. They inhibit D2 receptors, which also inhibit the GPI. In addition, the inhibition reduces the excitatory discharge from the subthalamic nucleus to the GPI. This balance between inhibition and excitation somehow maintains normal motor function. In Parkinson's disease, the dopaminergic input to the putamen is lost. This results in decreased inhibition and increased excitation from the subthalamic nucleus to the GPI. The overall increase in inhibitory output to the thalamus and brainstem disorganizes movement. Its cardinal features are a triad of akinesia, rigidity, and tremor, of which akinesia is a hypokinetic feature while rigidity and tremor are hyperkinetic features. Akinesia. The patient is unable to initiate voluntary movements. Manifestation of akinesia include 1. Delayed motor initiative. 2. Bradykinesia. 3. Mask-like facial expression. 4. Absence of swinging of arms during walking. 5. Shuffling or festinant gait. 6. Retropulsion. Tremor, involuntary rhythmic oscillatory movements of the distal parts of the limbs and head. Tremors are present at rest and disappear during activity, so they are called resting tremors and are the hallmark of Parkinson's disease. Frequency is 4 to 6 times sec, seen as frill rolling movements of the hand, i.e., rhythmic contraction of thumb over the first 2 fingers. Rigidity, increase in the tone of the muscles, both the protagonist and antagonist muscles. 2 types. 1. Lead pipe rigidity, uniform resistance to flexion, giving a feeling as if the lead pipe is being bent. 2. Cogwheel rigidity, series of catches during passive motion of the limbs. Posture becomes that of flexion attitude in which back is flexed, arms are abducted and flexed and the knees are bent. Treatment. 1. L-DOPA crosses the blood-brain barrier and is concentrated into dopamine and thus compensates for its deficiency. 2. Surgical destruction of globus pallidus or ventrolateral nucleus of the thalamus. Thank you for your patient learning.